How much does Medicare cost? In this video, I'll show you how to determine your estimated cost for Medicare and give you a few tips for keeping those premiums as low as possible. Watch until the end so you can find out how to get our free Medicare cost worksheet. Hi there, if we haven't met before, I'm Danielle Roberts, co-founder here at Boomer Benefits and a member of the Forbes Finance Council. My team helps thousands of baby boomers navigate their entry into Medicare every year. So what does Medicare cost? This should be a primary concern for you if you are nearing retirement, and the answer varies based on a couple of factors. So let's start by walking through what each part of Medicare costs. Part A is your hospital insurance. For most people at age 65, Medicare Part A costs nothing. This is because during your working years, you most likely paid FICA taxes that were deducted out of your payroll checks to prepay for your Part A hospital insurance. If you were working for at least 10 years or 40 quarters, or you were married to someone who did, this will qualify you for free Part A and you won't pay anything for it now. Now, for some reason you weren't able to get those quarters in, you can contact Social Security and you may be able to purchase Part A. This can cost upwards of $400 a month, but if you've worked at least 30 quarters, they'll prorate that premium and bring it down for you. Now moving on to the cost for Part B. Part B, unlike Part A, has a monthly premium that you'll pay every month. Social Security will deduct this premium out of your monthly income check, or if you're not yet taking Social Security income benefits, then they'll send you a bill in the mail quarterly. Here's the tip. If paying the premium quarterly is a hardship for you, you can also contact Social Security to set up a monthly bank draft until you begin taking your income benefits. Every year, Medicare sets the standard base premium for Part B, so this is the base amount that they can charge you from year to year. About 95% of all Medicare beneficiaries pay this premium, but some pay more based on higher income. We call this the income-related monthly adjustment amount, and really that's just a fancy way of telling you that if you earn more, you're going to pay more for Medicare. Now remember that statistically this affects only about 5% of Medicare beneficiaries and currently applies to anyone who earns more than $85,000 as an individual or $170,000 if they file jointly on their tax return. There's 4 different levels of higher incomes depending on your modified adjusted household gross income from 2 years ago. So here's how this works. The IRS sends your most recent tax return over to Social Security every year. They can calculate your Part B premiums for the upcoming year, and then people in the highest tax bracket will pay well over $400 a month for Part B. So you can see why it's so important that you look this up ahead of time and estimate what you'll be spending for your healthcare expenses in your retirement. In the notes below this video, I'll include a link to our Medicare cost page where you can look up your current income to see exactly how much you can expect to pay for your Medicare. Now here's a tip for those of you who have recently retired and were earning significantly higher income 2 years ago than you are now. You do not have to wait for Social Security to catch up to you. You can file a reconsideration request to ask them to reevaluate that premium based on documentation that you provide of your now lower income. I'll link to a blog post in the notes below this video where you can find more information on how to appeal a higher Part B premium. Now let's move on to Part D. When you enroll in Part D, you do not do this at the Social Security office. You're going to enroll in Part D by choosing a plan that's offered by a private insurance company. The base cost of these plans are set up by the individual insurance companies that offer them. These can range anywhere from, say, around $15 a month to well over $100 a month, depending on your state, your county, and the insurance company that's offering the plan. It's easy, though, to find out which plan will be the most cost-effective for you by using the Medicare.gov Plan Finder tool. Here at Boomer Benefits, we run that Part D analysis free of charge for anyone who enrolls in their Medigap or Medicare Advantage policy through our agency. It won't cost you a penny, and it can save you hundreds of dollars on your annual Part D spending. Here's my tip for Part D. The plan with the lowest premium is not the plan that is necessarily going to be the cheapest for you. Enrolling in the plan with the lowest monthly premium isn't going to help you much if 3 of your important medications are not included in that plan's coverage. The reason that we use the Plan Finder tool for our own clients here is so that we can see which plan offers the overall annual out-of-pocket spending. This takes everything into account, including your premiums, your copays, everything that you can expect to spend that year on your medications under Part D. Now, if you're looking for just a good ballpark estimate for what you might spend, we recommend that you use the national average Part D premium for the current year. Lastly, just like Part B, people with higher incomes will pay more for Part D, and again, this will be based on your household income. You can find a chart that shows you this on the Boomer Benefits website under the Medicare cost page. So that's it for our video about what Medicare costs. Now that you've got the cost down, you can start looking at what original Medicare covers and what your supplemental coverage options are. Before I sign off, if you would like to join our 6-day New to Medicare email mini-series, complete with short videos to guide you through each lesson, you can sign up for that below and we'll send you our New to Medicare checklist complete with a Medicare cost worksheet. Please also hit the subscribe button for our channel here so you can always be notified when we post new Medicare videos. Thanks for watching, and I'll see you in the next video.